I follow this young girl on Instagram, and it's not pervy, I swear. And anyway, she is 3 and she has a Southern accent, and she says, "Well, hey everybody." And that's what I thought is the best saying hi. It is the Southern accent of a toddler. And so I hope you hear that from me. It's with that enthusiasm that I greet you all. And more importantly, greet the new members of our task force. Lynn and Susan, are you guys here? I don't see their names. Maybe they're here in person.
I am here.
Lynn,
Yes.
welcome.
Thank you. I'm excited to be here.
In the Trenches Boys and Girls Club. Very exciting. Is Susan here? And then, John, I feel like Commissioner Scanlon, you officially got named or something to this task force. I thought you were already on it, but then we celebrated something about you getting named, and I'm all for
Yeah, I
celebrating.
was on it before, so I guess it's just
Yeah.
we do that reorganization every year, so it's just
Okay.
adding on for this year.
Score. And actually, I realize I'm going out of order. So anyway, that was the welcome. That's the special welcome to our new members. I'm going to now read our land acknowledgement. I would like to begin by acknowledging that we are here today on the ancestral homelands of Indigenous peoples who have lived in the Salish Sea Basin and the North Cascades watershed from time immemorial, in particular, the Lactamush people, who we recognize today to be the Lummi Nation, the Nuxalk tribe, and Semiahmoo. May we be mindful of the inherent owners of this land, our children, who are our future stewards of the land and advocates for the generation to come. May that truth guide our work and efforts to improve the well-being of all families and children, native and non-native, living in this beautiful country. The county, it's a beautiful country too. This land acknowledgement is not meant to be a substitute for authentic relationship building and understanding, and is meant to introduce us to one way we can show respect and honor the sacrifices of the first people of this land. Please join me in expressing the deepest respect for our Indigenous neighbors and gratitude for the enduring stewardship of our shared lands and waterways. Thank you all for listening to me on that. I'd like to now remind everyone of the task force purpose, and I apologize if I'm not looking you in the eye. It's because my camera's on one screen and everything I need to read is on the other. Personally, I like to go back to the purpose of the task force again and again and again. The purpose of the task force is to continually review Whatcom governmental impact on children and family and make recommendations for improvement of all departments. So we have to always keep that in mind at every meeting. I'd also like to remind everyone that there is an evaluation tool for this meeting that you can use. Allison, will you drop that in the chat just to make sure everyone can click on it? Because I'm getting it from the hyperlink from the minutes of the last meeting, and so I don't know that it's actually in the agenda. You can use that to evaluate the meeting as we go along. And also remind everyone, and Allison, if you drop this in the chat too, from the minutes, the agreements that we make amongst ourselves when we are at these meetings, rather than spend the time to go through them, put them in if we can go in the chat. I think that they're really helpful. The first one I'll name family and self-care come first. The last one is have fun. I think that sets the priorities well. And now I am going to not give you an agenda overview because you can read the agenda. We are going to do community shares and shout outs, but before we do that, I would first like to express gratitude to our outgoing co-chairs, Ray Deck and Christina Jackson. What more can we say? I hope all of the chats, the emojis are used, that it is celebratory and acknowledges how much these two individuals have given to this group, much less the children of Whatcom County and and everything, like your energy, your enthusiasm, your dedication, and your absolute polar opposites in approach are really excellent, because Ray's direct and Christina is a really kind, which doesn't mean that Ray isn't kind. It's just like the mixture of those two as co-chairs was an amazing blend. And thank goodness they're still on the task force. They're just not they're just out of this specific role. Maybe some quick words from Ray or Christina, if you wouldn't mind, to just say what it's meant to you and like rah for the incoming people and all of that.
Yeah, thank you. That's kind. It was a really productive, fun couple of years. We got a lot of great, important work done, and this is a very vibrant, active group. We do a lot of work, a lot of important work. I know some of our peer advisory bodies have trouble like making quorum and like actually getting themselves together to do anything. And this group, we've got a lot of sort of important stuff on our agenda, and I think that's a product to the industry and the energy and the passion of the folks in this group. So I think the task force is in great hands and um, strong leadership, and I'm really hopeful about the next year for Healthy Children's Fund and for kids and families in our community. So yeah, glad to be along for the ride.
Awesome. Christina, would you?
Everything that Ray said.
Love it. Awesome. Okay, so out with the old, in with the new. The new is myself, Sally Quinn, and Tilda. Oh, Tilda. I want to say it's Dowdy. I just don't know that I've ever said your last name out loud. Will you say it for the world to hear?
Yeah, it's Dodie, like donut.
Oh, much better. I like that.
Thank you.
And continuing co-chairs Colton Cottonfeld and Vesla Tomlinson, who she may be off, but being, oh yeah, she's not on the screen today. Vesla is not feeling well, but in a true testament to Ray said about people wanting to attend to these task force, like she's showing up even though she's sick. Like that's pretty stinking awesome. Okay, so that last thing we're going to do quickly are community shares and shout outs. I have one. The Whatcom Community Foundation just sent out a share and shout out that they are hosting the Washington State Solicitor General, Noah, last name escaping me. He's going to be coming on March 5th, I believe, to the Squalicum Boathouse to give an overview of the concept of gift of public funds. I'll drop that in the link or in a chat as well, so people know who to RSVP to. Anybody else?
Can you, I just dropped our meeting minutes, but can you do our meeting minutes before you go on to Sarah too, Sally?
Thank you. I should know better. Okay, I am going to move to approve the minutes from the last meeting of the task force, which was what, December 30th? Yes, December 30th. Does anyone second that motion?
I have a question about the minutes. Sounds like you got a second from Sterling, maybe. In the minutes, it seemed to indicate that the fella from City of Bellingham who came in place of Samya, that was a permanent change, that he's replacing Samya. No, that's temporary. Okay, that was my understanding too. The minutes seemed to indicate that he was replacing Samya, and I didn't believe that that's what I heard in the meeting. So that's just a friendly
Good
amendment.
catch, Ray.
I'll fix it. Yep, thank you.
So I think with that changed, my motion will still stand, and Sterling, does your second still stand with the change?
It does.
All right, all in favor, raise your hand or drop it in the chat, whether you approve, a thumbs up or something.
2, 3, 4, 5, 6. And we convert to just chat interaction instead of screen and chat because we're just want to make sure we're capturing everyone who's trying to engage. Thank you. This keep like scrolling up every time. Those have been approved. Thank you.
Awesome, thank you. Okay, back to community shares and shout outs. Anybody else? Thank you, Pamela, for dropping all that info in the chat.
I think John and I both have something. John, you want to go first, and then I'll follow you up.
Yeah, sure. So 2 items I just wanted to let folks know at the council meeting tomorrow. We have a few Healthy Children's Fund related items. So first, in the Finance and Administrative Services committee meeting in the morning, there will be a few contracts up on the agenda. So that's at 9:35. I will put the link in the chat to the agenda for that meeting. And then in the next committee meeting, which is the one that I chair, Public Works and Health, we have 2 items related to Healthy Children's Fund. Sarah will be there for both. One is a presentation on CREC, the Center for Retention and Expansion of Childcare. That contract is also up for approval in front of council tomorrow. And we'll hear more about CREC from Sarah and from Opportunity Council, and I believe from Guy from the Chamber. I think we'll be discussing that as well. The second link there is Public Works and Health. And then Sarah will be giving an update on the Healthy Children's Fund. And there is a memo in that agenda file, as well as the latest table of contracts and funds and where things stand. So this kind of mirrors the table that the task force has. So you can see the latest there and how things line up. So anyone interested, feel free to join us in chambers or remotely, or if you can't make it because it's in the middle of your day, check the video when it's up later in the week. And then thank you to the folks bringing Noah Purcell here to talk about gift of public funds. And I was curious if anybody knew if he would be meeting with our prosecuting attorney's office or with our executive. Wow.
So that I've been in touch with Maury Ingram from the Community Foundation to try to make sure that the invite is extended to all of the attorneys at the city's office, the county office, and frankly, our regional, like the city attorney Anacortes or Mount Vernon, and local attorneys who represent cities and counties in-house.
Okay. I'm kind of wondering if there might be something in addition to that public event. I think it'd be great to get Noah.
Noah is coming to the Whatcom County Bar Lunch that happens every quarter, and that's why the 5th was chosen, was because we're having a bar meeting that day. And then I'm hoping to work with him and the bar president to see if there might be a lawyer's social event in addition to that lunch.
Yeah, I'll reach out, Sally. I'm thinking about something else. I think a sit down would be helpful.
Oh, well,
so
that's
that
between
folks
you
can have a private
other
discussion
people. We
so
might
that we can work through some of the issues that we've all been trying to work on. To get to our specific issues, I think Noah could be helpful. I think that'd be a helpful conversation.
And I think we should all be encouraging the people that we want to come to RSVP and be there, because we're hoping to be able to offer continuing ed credits. We don't have that confirmed yet, but we'd like some other enticements. So if you can pass along that invitation and encourage folks to come, he's just got a lot of wisdom and experience, and I think can be a helpful resource for us for learning, but also figuring out a little bit more about what we need to file for to get some rulings on things. So I encourage
Yeah.
folks to, and to encourage people to come who we want to be there.
Okay, and I'd be happy to, I could be a convener too and host something in the council conference room to get at our very specific stuff around the Healthy Children's Fund.
That's great. I'll pass that on to Maury.
Thanks.
Any other, Sarah, your hand is up. Did you
Oh,
have
yeah,
more?
thanks. Yeah, I
Uh-huh.
just want to let folks know that this weekend is Bellingham Technical College's Focus on Children's Conference. And that is a one-day conference where, they're just talking about community and continuing education around early learning and care. I know there'll be lots of childcare providers there, and I'm presenting with Lori Saline from the Opportunity Council around the Healthy Children's Fund and the P3 framework. So I'm throwing it in the chat. If people want to RSVP, there is still time to do that. So I'm really looking forward to the opportunity.
Awesome. Anybody else? Well, if you remember it, you can throw it into the chat or maybe at the very end. So let's turn it over to Sarah for a Healthy Children's Fund update and subsidy update. And just to keep everyone, and this, Sarah, this doesn't mean cut it short, just a reminder to everyone that's presenting, we are running 10 minutes behind schedule.
Okay, thanks, Sally. Well, it's so nice to be with you all today. I had a little treat this afternoon, and our youngest child got to come to work with me for about 30 minutes. And it was such a nice reminder, I think, for me, who sits at my desk and works with adults all day, like what we're doing here and why we're here. And I did have this fun thought that I thought, what if we had a council meeting where all the children in Whatcom County were invited and just roaming around? So John, I just want you to know I'm broiling something up just to if we need some help focusing on what we're doing here and who it's for. That I know was a really nice reminder for me. But I'm happy to be here with you all. I'm sorry I missed you in December. So just diving right into the narrative portion of my report that I sent out, the implementation team is working really diligently on the implementation plan. And at our last couple meetings had the opportunity actually to have some really wonderful crossover with the subcommittee of the Healthy Children's Fund for this group. And so we really continued to narrow in on our strategies and refine the work and direction that we want to take the plan. And really, as we continue to examine our priorities of the Healthy Children's Fund, our strategies where money's been spent, the group really wants to continue spending on things that we already have been spending money on that have been working really well and have been effective and align with the work, bolster, our current funding plans, such as the subsidy, consider how we might expand the subsidy plan based on the state's budget, potentially expand rate augmentation in new and unique ways, and then select a few new projects that can build on the past good work. So we can really focus on what we're doing, put a lot of really good resources and to expand current projects that are effective, and then work on a couple new projects. And I think the other thing that has kind of been our secondary goal is really just to make sure that we're articulating as clearly as possible the work that we're doing. I think the work of youth and families is really complex. If you just look at one section of the system, it can be really challenging for anyone to kind of understand who's on the outside. And so the analogy I used at the last implementation plan meeting was that we're making maple syrup, right? We're really boiling down the good work we're doing to help inform the public. And so that's the direction that we're taking the implementation plan and how we can simplify our messaging, not to reduce what we're saying, because we don't want to be reductive, but just to really help make the messaging as clear as possible. And so really looking forward to that. I will give a little bit of an update on the work that the group has been doing tomorrow during my presentation with council. And we're still on track to have a draft late February, early March for community feedback. So we'll be able to post that on the website and have community members provide feedback. And then of course, from this group at large as well. The Innovative Services Fund, as you all know, for early learning and care, that RFP closed and we ended up awarding $1.8 million. Allison Halverson and Jesse, for our contract coordinator, have been working so hard and completing all of those contracts. And on our end, we're going to continue to meet the expectations that was put forth in the resolution by council. So feeling really confident about all the work that the team is doing to get our contracts moving, having a lot of great success working with partners who submitted applications and had success. And it's been exciting because there's new folks that we're working with that we haven't worked with before, and that we're also learning a great deal from. There's one new provider that we offered an award letter to who's opening up a childcare center for the first time. And she has been so gracious, and we're walking alongside her in all these steps of the process that are kind of unknown, that you wouldn't normally have to walk through with someone who's contracting, who's done this before. And so we're learning a great deal and developing some procedures and things behind the scenes for that process. And I also want to give you an update that the RFP for the subsidy and rate augmentation program is going to be ready by the end of this week for internal reviews. And so there's a timeline that Erica and the rest of us created to meet some deadlines for the subsidy plan. And so we'll be done with our portion of the RFP by the end of this week, and looking forward to have that done. John mentioned that there's going to be 2 contracts that go to council this week or tomorrow. And those are, one is for CREC, which is a program through the Opportunity Council and the Bellingham Chamber of Commerce, with which its goal is to expand childcare. And the contract that we are working with them on is kind of twofold. One is to expand small and medium providers in Whatcom County. And then the other one is to develop at least one employee childcare partnership. And so work with an employer in town to develop a childcare program just for them. I'm extremely excited about that particular project. And then the other thing that will go to council tomorrow, the contract, is for our drop-in care system. So very excited to get that rolling. I know that they have already been kind of connecting with community partners, those who deliver foster care services in our community, and are working towards building a really strong network and system for a drop-in care program here in Whatcom County. It's really cool. We're doing something that no one's ever done before. It's very innovative. In the way that we're doing it. I know we've had drop-in care childcare in Whatcom County before, but not necessarily kind of an online system to do so. So really, really excited about that. And the other thing I want to add that I forgot around the innovative services is that we have several projects that are delivering programs in early learning and care facilities like OT, speech, behavioral mental health services, things that have never been done before in that particular capacity. And I am starting to work with Western to help us develop a evaluation of those programs, so we can look at them against each other and talk about, okay, what went well, what didn't go well, what was good for the providers and the children. Because what we know is we've just received this great call from our providers, our childcare providers in our community, to have more auxiliary services on site. And we want to be really thoughtful about how we develop an RFP in the future that will likely focus on that work. And so having Western kind of come in and help us evaluate that will be really, really exciting. The Healthy Children's Fund Subcommittee, this last week, what we did last time we met was just really look at the provider feedback survey. So you all will receive a survey, as well as the Healthy Children's Fund Evaluation Plan Advisory Group, and the implementation team will receive a survey from our evaluator, Hunter, around things that have worked or haven't worked, or expectations around the Healthy Children's Fund that will go in the first evaluation plan. And you should get that. I think tomorrow morning she's going to send that out to everybody. And so the Healthy Children's Fund subcommittee really helped me look at that survey. We talked about having it be more balanced and not just qualitative. And so there'll be 2 quantitative questions in that survey. We're looking forward to seeing the results of that. And then the other thing the group worked on, which was so nice, is provided feedback on the evaluations and metrics sections of the 25-26 Healthy Children's Fund implementation plan. So that was really great and helped move us forward. In terms of staffing updates, we're working to refill the early learning and care program specialist position, which I'm deeply excited about. Having that position be open and unfilled since August has been really tough on my team and I. And so we've kind of moved through those first steps to move through the hiring freeze, which I'm really thrilled about. In terms of evaluation updates, just a quick one around the rapid survey from Stanford. We had our first meeting post close of the survey, and we had over 350 completed responses of the rapid survey in Whatcom County, which feels so huge. That's a lot of survey responses. Big props to Vesla for getting that, encouraging us to do that. And at first glance, when you look at the results from people across the county and where they lived, it actually looks really really good in terms of percentage of population across the county. We had surveys submitted from every city in Whatcom County, and so it feels really reflective of where folks live. So that was really, really thrilling. And then let's see. And then the other thing I just want to add is just around outreach and communication. So an RFP just recently closed. We're planning to hire 2 different folks to help us with our communication efforts for the Healthy Children's Fund here in the next year. One person will be kind of more project managing, and then helping kind of pull together the work. And then the other contract that we've hired will help actually create content that will go in those in all of our media. So really looking forward to that. And then I forgot to add, but I put up a sign last week at the Samish Commons where we're building out childcare that is ARPA related, but it was really fun to have like a big, huge physical sign go up on the street with all of our logos on it. And I forgot to include that picture, but I'll send it out to everyone if you want to see it. So that felt really good. So there's a lot of narrative around what we've been up to lately. And then you also have the project tracker in there. We will start to use this spreadsheet. I will say it was like, I feel a little embarrassed, but it was a little difficult for me to figure out how to send you the spreadsheet in a PDF. I can talk to someone techie about that later. So we did a screenshot. I don't know why it was so hard. I'm a little embarrassed to say, but so anyway, I'll figure out maybe a better way for you to view it, but that gives you a really good idea of like the contract amount, which we'll get more specific about who the contractor is, proposed deadlines, award letters, and all this information. So you can really see how it aligns with the resolution that was passed recently. So I just talked a lot. Looks like Tilda has a question. Go for it, Tilda.
Yeah, I just had a quick question from your report, Sarah, under evaluation updates, the second paragraph. I was thinking we had talked at that last meeting also about
the contractors.
Yeah, sending the survey to some contractors.
Yeah. So during the subcommittee meeting, there was a question about, and so they're actually already being asked those questions in a report that comes in at a different time. The other thing so we did discuss this, so thanks for the follow-up, Tilda. Tilda's question was like, why aren't we also sending the survey to contractors? And so they're already being asked similar questions in their regular evaluation reports. And we also wanted to leave room for them to meet with our auditor, who should hopefully be coming on soon, and that they'll be able to be even more honest with. So we're not excluding the information, but we're getting it at a different time. And so I talked to Hunter about that. And when we receive our information around their experience contracting with us from their regular 6-month report, we'll create a separate little document that rolls all those things up and share with everybody.
Perfect. Thank you.
Yeah, totally. Vesla, go for it.
Yeah, I have a question and we can get to it, I think, when we talk about the report card that we are writing, but I want to make sure that we get to that since we're going fast on time. Because this happens every year and we have a hard time getting our report card in on time. And I'm noticing that again, the timing is funny where we might not get the implementation draft until early March and we'll have already voted on our draft. And in order to not have that draft be sort of useless, and I don't know, but I don't know the answer to that, but I'm wondering, and also Representatives or Councilmember Scanlon, your opinion of asking for a delay in that to match up so that we can review the implementation plan, or what kind of folks' thoughts are around that kind of misalignment. I know we have time in the agenda, but I'm wondering if we can talk about it right now instead, since I want to make sure we talk about it since we're supposed to vote on it at the retreat next month.
That's a really thoughtful question. I think I could get you a pretty strong draft by the end of February for the group to look at, but it wouldn't have all of the community feedback in it. So it would be kind of the direction that the implementation team is hoping to go. I don't know if that would inform your report card enough, but that's what I could provide. But that's a good question. Yeah, John, do you have any opinion about if they turn in their report card after the implementation plan comes to council at the end of March?
Yeah, I mean, I think last year, we had this come up, right, where the report came in after the deadline, and then it was so close to the next report and so many other discussions. And I would rather that we stick to the schedule for the reporting from the task force. Because then, I think when we delay things, then we end up coming up against other deadlines and other work. And I think it would be helpful to have that report on time. And I think, if the report could have recommendations for the next phase of the implementation plan, you could put that in there.
Yeah, I think my worry is that we won't have, like, if we're supposed to vote on it on February 28th, folks won't have the time to have looked at to provide some, like, I don't know how useful it is to have like out of the blue recommendations on the implementation plan that maybe are against either what I don't know, my brain's a little foggy right now to think about it, but I'm just seeing these kind of deadlines colliding. There's a world where maybe we write a report that has nothing to do with the future implementation, but that all feels like, council is going to be reviewing our report at the same time they review the implementation plan based on these current dates. And without that information feels funny, but if no one else is worried about it, I won't bring it up.
Well, I have a comment, Vessel, that maybe the report card, it has to be somewhat vague on the actual content of the implementation plan because we won't see it, but it focuses more on the timing and the way in which we perceive the implementation plan coming together. And I would assume that just because it's not required, we can always do more than we're asked of, and we could do a supplement to our report card once the implementation plan comes up and ask for time in front of council to look and review at that, because I do think that point is really accurate, that, and we already have that with the audit, that like the audit's going to come after the plan as opposed to inform the plan, and then some of that stuff's going to be trued up in the future.
Okay, maybe we can just talk about it in that subcommittee meeting then, I guess.
That's what I was thinking. And there's also a few crossover members between the two groups, and I think it's important to have the task force's input before we complete the implementation plan. I also think the implementation team is really well aligned with the task force, and so I think things are moving in a good direction that I would imagine everyone would be pleased with. I mean, I don't want to make any assumptions, but yeah, for sure, Vessel, I think we should talk about it.
Yeah, I like that idea that Sally proposed, and I just want to reiterate this. You all should feel free to send any recommendation to the council at any time that you want. That's why we have advisory committees.
Awesome. Okay, well, let's jam on along. And
wait, Ray Deck has a question.
Oh, Ray, honestly. Okay, fine. Make it quick.
I'm gonna point out that this traffic jam we're dealing with is like it's sort of a unique phenomenon of this year. And it's like the way that the Healthy Children's Fund like accountability system was designed to work. The external evaluation task force report should be completed, and those things should then inform the development of the next implementation plan, which then informs the development of the following like biannual budget, right? So the cycle is evaluate and report, plan, budget, and then 2 years of execution, and then repeat. We got a little bit off to an awkward start because of the way that the sort of rollout happened. And it's just, it never happens as cleanly and neatly as you want, but that is the sort of intended like cycle, is report, right? Evaluate and report, plan, budget, execute, repeat. And that sort of a repetition of that intent, the number of us on the implementation team have pointed out that's how it was designed to work. And that's not what we're doing now. There was like a pretty nice, it was in colored pencil, but it was a pretty nice like timeline that we mapped out in one of our meetings about this is how it's supposed to be. And here's like the plan to get ourselves back on schedule. So my hope is that maybe it will be in like pixels instead of in colored pencil, but a version of that timeline is going to make it into the implementation.
It's going to be in the new plan. Yeah, totally.
Great. Sweet.
Yeah.
Short-term problem is what I'm saying.
And maybe we can include that caveat with our next update too, so that
we could put that timeline in there.
It doesn't look like we're completely missing the boat, right?
Okay, let's move on to memo and resolution update. That is Vesla and Ray. I'm assuming, Ray, you're taking the lead on this.
I can, yeah. So this is just to close the loop on we drafted a memo and sent it to the council. This was in response to a specific request from Councilmember Buchanan, that we draft a memo about clarifying our understanding about evaluation. We did so. It went, that informed the edits that the council made to Councilmember Buchanan's resolution about the timely awarding of contracts, and that did pass 7-0 with a 7-0 vote, which I thought was pretty noteworthy, that there's such broad support for this work happening in a strategic and efficient manner. So that's the rest of the story, as they say. Did I miss anything, Vesla?
No, you did great. Thanks, Ray.
Great. There we are.
Only did he do great, he caught us some minutes up. Let's
And I
open
knew I
the
would.
work group updates. Who are our work group? Colton, do you want to report on your
Yeah, still working on it. It does look like the county council, or not the county council, but the health department is going to be able to throw some money at us for the little work session that we have been working on pulling together, probably in like April at this point, March or April. Let's see here. So that's where we're at now. Kind of just working through a couple of the logistics on that, but hoping to have a little bit more to report back here soon.
Thank you, thank you. Anybody else? All right, let's get to the star of the hour, Catherine De Filippo. I've just butchered your last name, so prefer to, if you would, please just say it out loudly and correct me. And please present to us on children and youth with special health care needs and disabilities in Whatcom County. We're so excited to hear from you.
Do you mind, Catherine, do you mind if I just jump in and introduce you for a minute before you get started? Okay, cool. Thanks. Catherine was here at our last meeting in December, but I wasn't here. So I just wanted to jump in and say, Catherine is a wonderful Whatcom County Health and Community Services staff. She is on the team that I support, who support children's and family programs here. And I've asked that she starts attending these meetings with us because there's just so much crossover. It's wonderful to have her wealth of information. And she works really closely as well with Beverly Porter from the ARC on Whatcom Taking Action. And I just feel like the more we dive into the Healthy Children's Fund and the work that we're doing, there's just so much crossover between all of our work. And so really trying to blend those things in an appropriate way and also build up everyone's knowledge around kids with special health care needs and with disabilities. We want with any particular population, I see it as our goal. My goal is to support everyone and having a really strong baseline information so that if somebody is not here who's an expert, those kids are not forgotten. And so that's one of the roles I see with the presentation that Catherine's providing today, is to really help kind of boost all of our knowledge around the work that's happening in Whatcom County with kids with special health care needs, and that we can all speak out and advocate for those children and families if she and Beverly and other folks just don't happen to be present. So really appreciate Catherine coming today. She's worked really hard on this presentation, and we're really excited that she gets to share it with you. So thanks so much, Catherine.
Thank you. And thank you for that framing. I feel so grateful to be here. And actually, when I look around this room, I can see that there are a lot of experts in this space who are parents themselves, have worked with kids with disabilities, and have been advocating for a long time. And so I'm so grateful to Sarah for inviting me into this space to have this conversation, and also look to all of you for the places where we have just where we can add more nuance to the data and the stories that I'm going to share. So I'm going to try to present. So give me 1 second. Actually, I'm going to do. Okay, so I'm going to do a share screen. Okay, I can't see my notes, but I think we'll be okay. Okay, can you see this slide? Okay, perfect. Okay, so sorry, I'm gonna move this. As Sarah was saying, a goal today is to increase awareness around children and youth with special health care needs, build a common understanding. I think some of the information that I share will be very familiar to some of you, and maybe some of it will be new. But if there's things that you want to add, definitely invite that, because our goal is also to spark conversation and connection and identify some gaps and some opportunities. So first, we want to start with a common understanding of what disability is. So disability includes a range of physical, cognitive, emotional, and sensory differences that affect how a child interacts with everyday life and learning. These differences exist on a spectrum, and they're a natural part of human variation. And many disability advocates would remind us that disability is a natural part of the human experience. Disability is very outside of our medical model, which is something that we need to fix and treat, but actually most disabilities people live with for their lives. And so what support looks like is helping those individuals live meaningful and productive lives. And the way that we see and perceive and support individuals with disability is also impacted by our culture, by our race, by our gender, by our socioeconomic status. All of this interacts with how a disability is perceived by society and the support services that are available to individuals. So there's different types of disabilities, and these can be interconnected. They're not always obvious. They're often co-occurring, and many disabilities are misdiagnosed. We see that often among women with ADHD, and we also see that within the BIPOC community. But there's developmental differences, learning differences, physical differences, sensory differences. So this can be anything from sensory processing, like sort of hypersensitivity or lack of sensitivity, or differences in the way an individual hears or vision, and as well as behavioral and emotional variations. So in our conversation today, we're also going to be talking about children with special healthcare needs, which is a little bit of a broader umbrella than children with disabilities. So the MCH, the Federal MCH Bureau includes children that are at risk of disabilities and also those that have a health condition. These would be the types of things that your school nurses are working with. Things like asthma, it can be seizures, it could be allergies, just a variety of conditions that makes it so a person is more likely to interface with a medical, healthcare, and other social service systems than their peers. So disabilities, we don't really, for most of them, we don't know what causes them. But in some cases, there's a complex mix of factors from genetics, but also environmental, and even things like trauma, illnesses, and things that we have control over, and some things that we have absolutely no control over. In Washington State, the conversation that we're going to have today is looking at some particular systems and why things are going well in some cases and why things are not going so well in Washington. And some of this data may surprise you, it may not. But in Washington State, children and youth with special health care needs are less likely to receive care coordination, get paid as a caregiver, have a medical home, and receive family-centered care than other children throughout the country. We also rank 49th for children receiving care coordination. More families in Washington State are more likely to have to leave a job, take a leave of absence, or cut down on their hours due to caring for a child. And in Washington State, we have a slightly higher number of children and youth with special health care needs than the national average at about 21%. So while kiddos' experiences are different and families' experiences are different, and oftentimes if you meet someone, they'll say, well, if you met one kid with autism, you met one kid with autism. But there's definitely some characteristics that across the board families are experiencing, and they're similar. Often these families are having to frequently have medical appointments, specialty appointments. They may need additional support services, and families are the ones that are shouldering the burden of this fragmented system. This leads to the emotional experiences of families being varied from feelings of joy and resilience to feeling completely isolated and just exhausted. Time and energy demands, financial strains, and then many families find a sense of community and a sense of support through their child's disability. And almost all the families I've ever talked to are incredibly hopeful. Today in particular, we're going to be looking at 3 themes. I swear it's like so complicated that I felt like I could talk to you for hours, but we're going to try to distill it down to the 3, I think, most complex systems. So lucky all of you that will be looking at those today. But before we get into it, one of the things that I think is really important is understanding early relational health. So early relational health health, early relationships likely account to 25 to 50% of population variation in critical child development outcomes. And we also know that the parent-child relationship can act as a buffer against stressors and even poverty and racism. Sometimes we think of development as these separate domains, right? Like the physical, the social, the sensory, and maybe we don't see how those things interact and interface with each other. But a framing that I want to offer you all, and it's from Instagram of all places, is a developmental psychologist said that actually a way to think about it is to put the relationship at the center and all other development extends out from there. And when you think of it that way, it's how we can think about basic developmental like supports you would offer a child or a family, things like as simple as tummy time. The work that I think we're doing in the community is how do you set up the conditions so that tummy time goes from looking like something to like this to something more like this. Not that you need parents to do that all the time, and there's definitely different cultural ways in which families interact with their children, but it's saying at the heart of promoting development is a relational attachment between the parent and the caregiver. And within our community, ESIT throughout Washington State uses a framework that does this. It's called Promoting First Relationships, and its aim is supporting the attachment between the child and the caregiver. In Whatcom County, we have higher rates of our kids entering into ESIT services than Washington State. And actually, before I get into that, ESIT is, many of you know this, but just in case, ESIT is seen as both a prevention and an intervention service. So access to ESIT is a lower level of delay. So it's a 25% delay. In some cases, it's provider interpretation. And in our community, kids that are in the child welfare system are automatically accepted into our ESIT services. And I know, Tilda, you could speak all day about ESIT. And one of the reasons that we have such higher rates of ESIT in Whatcom County is very likely due to our SEAS line. SEAS was created, actually, is like pretty amazing. SEAS was created in Whatcom County by grassroots efforts as a way to help families that have a child with a disability navigate the complex system. Within our community, the providers are the #1 referrer, and a good portion of the kids that are accessing the SEAS line are under 5. In Whatcom County in 2024, there was 1,439 kids. So I got some data from ESIT. They were so kind to share this with me. And they gave me like a data snapshot. So they said, here's all the kids in 2023. And there was 910 kids. And this is a little bit of a trajectory of what you would want. You probably would want your 2 to 3s higher, but you would want higher number of your kids coming into services 0 to 1, and you would want to see a slow tapering with the idea of you're catching kids early and you're connecting to families as early as possible. So in ESIT, the majority of our kiddos are boys that we're seeing, and a good portion of them are getting SLP services, second to OT, followed by PT. So the population data that I have is 0 to 18. ESIT is 0 to the 3rd birthday. These populations are likely more diverse than our older populations. So while we're pretty online with race and ethnicity data, actually research indicates that it's very often that BIPOC children are less likely to be identified for ESIT services and less likely to actually be connected to those services. And we can kind of make some slight assumptions based on this data that if we had the 0 to 3 data population, we probably would see some slight discrepancies within that data. So there's barriers in accessing ESIT. There's awareness and understanding, and there's also just challenges in terms of even accessing it generally. Most of the services are before 5 p.m. Families have to schedule appointments. There's a role that the family needs to take to logistically match ESIT for their family. There's culture and language barriers where ESIT does provide translation services, but the services may not be the best match for that family's culture or language or preferences. And then the biggest one, I think, is there's an incredible amount of stigma around parenting and just parenting in general, and a lot of stigma around disabilities. But we have things that make our families connect more easier to ESIT services. For sure, provider referrals. Our providers in our community are doing screenings at well child visits, and they're connecting families to ESIT. You have Cs, which not only acts as a resource network or a resource place, it's also the entry point for ESIT. So actually all ESIT goes through the Cs line, which is incredibly beneficial in building trust with our providers and helping families connect to services. And then you hear often how oftentimes school district, like migrant family liaisons and other cultural liaisons, will help families navigate and understand the ESIT program and connect them to services. So I'm going to move to talking about the school system, but before I do, I just want to pause and see if there's any questions or anything that anyone wants to add in regard to ESIT. Okay. So of the data snapshot that I got, not all of the kids had gone through like a transition. This is when they go from their 3rd birthday into where they kind of identify what's the next path for them. But of the kids, about 30% of them qualified for school-based services. And it's very likely that there's some percentage that's probably under 50% would, I don't know exactly, but there's a funneling. So you go from ESIT, which has a broad enrollment, to school-based services, which is much more focused. And the school-based services are identified through an IEP, which is, so ESIT services are family-based services. School services are individual plans that identify services for that child, including speech, OT, academic supports, and other accommodations that that child needs to succeed. The important thing that I just want you all to know, and there's more here, but that schools have a funding cap on how much additional funding support they get for kids within special education services, and it caps at 16%. So if a school has a higher percentage of kids with special education that are in need of services, they don't get additional funding. And we can see within our community, you have a range of kids that have IEPs from 9 to 22%. The enrollment cap is specifically detrimental or challenging for schools with lower enrollments overall, schools that have less local property tax revenue, with more schools that have higher percentages of students with special education, and schools in rural locations, or more students experiencing poverty. And in reality, schools are spending more of their local and local resources to supplement the lack of funding that they're getting to support kids with IEPs. One thing to note is that the national research and finance experts suggest that the disability category is a poor proxy for the additional amount a district needs to educate a student receiving special education services. So this is in addition to, we already know that our schools are strapped financially, and then you're adding to it this enrollment cap, which puts schools in a really tough position. And this inequity translates actually to impacting our students. So the way to get an IEP, it's basically through either a parent request. So parents have to submit something in writing, which can be very challenging and confusing. And OSPI has recently created some resources to help families, or a school request, which could be filled with bias. And so what OSPI has done is they track a pretty considerable amount of data. And one of the things that they look at is, are certain groups being underrepresented or overrepresented? And in Whatcom County, what we see is that in our communities, this is from some of our school districts, we see that there is an overrepresentation of American Indian and Black and African American students within our special education services. At the state level, when they do like a data roll up, what they see is that there is a trend in Washington state where Black children are more likely to be referred for an IEP, less likely to qualify for the IEP, and more likely to stay within special education service or special education longer than their white peers. So another, I guess, important data point is that there's also a higher percentage of kids that are getting expelled from school as a result of just many factors, but to just show us that in Whatcom County or in Washington state, 7.5 students with disabilities were expelled from school for either short or long term. And in Whatcom County, those rates are pretty on trend, where we have 6.5 to 9.9% of students being expelled. One step towards more equity-based practices is through inclusion. But as you can see, Washington State has ranked really low in our inclusion efforts. In 2018, 44 out of 50. In 2019, 45 out of 49. These are from different sources, so that's why they've got that. But in 2019, the legislator funded a couple of pilot sites to begin the initiative to move forward with inclusionary practices. And the evidence is really mounting that inclusion works for kids with disabilities, and it really also works for kids without disabilities. But I want to make sure that we all understand what inclusion is. So inclusion isn't simply just putting kids with disabilities in the same space as a typically developing peer. Inclusion is more, I've heard it described as like an action, like it's a verb. It includes adequate teacher training and professional development, smaller class sizes, and sufficient staffing, which may mean bumping up the number of adults in a space, collaborative planning time, access to resources and assistive technology. You do pull in rather than pull out services. It's supporting positive school culture and family engagement. And I saw that Christy Dominguez was on the call, and one of the things that I really noticed was Ferndale did it was like the early learning plan, and all of the components that are identified here are specified in the plan. So they're being super intentional with how they're creating inclusive spaces. And these data points will likely change over time. But the thing that I wanted to highlight, this is from, I think, 2023, or it's 20 trends over time, but I think this one's 2023, was that, sorry, just like a really deep breath. The point that I wanted to make on this was that our early learners are getting varying levels of exposure to inclusive environments within our community. And particularly for really young kids, exposure, or they're learning so much through their peers. So inclusion has this added benefit of not only supporting more compassionate and just caring environments, but it also actually is really supporting the development of the kids in those classrooms. When you talk to folks about navigating the school-based system, it's really complicated. Most folks will tell you stories about, I just got lucky, I got the right teacher, or somebody noticed something, or just it's a whole range of different things, and it happens at different times, but oftentimes it's like a happenstance. And the things that have worked for families often have inequity throughout them. You have to have a family member that's able to advocate at the school level about the needs of their child, to communicate that and to follow up. There's often a supportive person within the system who sees the parent working so hard, or who notices something and helps that family get the services that they need. And there's oftentimes families are connecting with each other and learning from each other about how to navigate these complex systems. So maybe I'll pause there, because I'm next going to do Medicaid. And maybe I should check if there's any questions. Maybe I'll take a little pause, because then we're going to move into the healthcare system next. So is there what's on folks' minds? What questions?
I had a really quick question, Catherine. I think that there was a lot being said when you said that certain groups of kids are referred for IEPs, but very few qualify. And that just from a common sense perspective doesn't make sense to me. So I think there's a lot more underlying that. Would you unpack what that is really saying?
From Washington State is where I got that data from OSPI. So they said when they roll up the data at the state level, that what they're seeing is more Black kids in particular are getting referred for IEPs. So that's like a parent or a school provider saying, this kid is in, let's do an assessment of this kid, less likely to qualify based on those assessments, but more likely to stay in services. When I looked at the data locally, what I was able to see, I don't know how to look at the refer data. I was just able to see the number of kids in our community that have IEPs. But I think the point of it is that, and maybe Beverly can help clarify this as well, is it took me a while to wrap my head around this too, because I was thinking you would want more kids to qualify for an IEP and that was an indicator of support. But I think what it is it's putting kids into special education services, which isn't necessarily addressing whatever is the referral, the thing that's indicating the referral.
Would you like me to share a bit more, Catherine?
Sure, if that's helpful. Yeah.
Hi, folks. I'm Beverly Porter. I'm sorry I didn't get my whole name in with this, but I'm a part of Whatcom Taking Action with Catherine, and I work at the ARC of Whatcom County, where we work with folks who are trying to access special education services, etc. So the piece that happens is once a child is identified as possibly being eligible for special education services, there are a wide variety of different assessments and evaluations and tests that can be done. And what the school district needs to do, and they do in that evaluation process, is take a look at, is there a condition or a disability that is having an impact on that child's academic performance, is having an impact on that child's ability to get access to the curriculum and the information and participate in the class. So they have to line it up very specifically with academics. And so that's why a family might go through with the IEP process and understand that a child maybe has a particular condition, let's say an example being ADHD, but that child maybe has been on medication and has had some therapy and other supports. And so when they look at that student and their working memory and their processing speed and their ability to get their work done, et cetera, it's not having an impact on their academics. And so they might not then qualify for specially designed instruction specifically towards that hyperactivity, impulsivity, et cetera. So that's kind of an example about what that looks like. And yeah, so it's a long bureaucratic process, but it can be also very helpful.
And I see, Jamie, you have your hand up too.
Yeah, I'll speak a little bit about my experience. My son was born with low muscle tone and he got referred right off the bat for ESIT, which is the early intervention, and that was amazing, and he graduated out of that. And I noticed some problems with his speech at about 3 or 4, and I took him to get assessed by the school district, and they basically they nicely laughed at me and they told me that my son was not bad enough to receive services from the school district. So I had to take time off of work every week and try and get into private speech therapy so that he wasn't so behind by the time we got to kindergarten. And the problem with this system in early childhood is that we see kids all the time from 3 to 5 that need extra services, but they're not deemed bad enough to get services. And so those are the kids you see getting expelled from preschool programs, that can't stay in group care because they can't get referred for services because they're not that standard 2 deviations below grade level, which is difficult to quantify for a 4-year-old. And yet they don't make it into general mainstream childcare type programs. And so we have this whole population of kids that we're sending to kindergarten not prepared, not because no one cares, just because there aren't enough services or wraparound care for these kids who really need that extra support but don't qualify through school district intervention. So it's frustrating as a provider to watch it because I see so many kids that I know are going to struggle when they go to kindergarten the next year, and there's not a heck of a lot we can do about it as providers.
You are not alone in that story, and also you hear often about how folks will get school district services, but how much it's not meeting their need, and then they're having to find other supports, and even just being able to access those other supports is a privilege. And we'll move into the Medicaid conversation, which you'll see more about, because the other supports are often underneath Medicaid. 40% of the kids in Washington state have Medicaid. one good thing to know, I mean, Medicaid has so many good things, and one really in particular to know, and that's important for this group, is Washington State is one of 7 states that expanded coverage for children up to age 6. So that means if a kid gets on Medicaid very young due to, let's say, a hospital stay or something else happening in their life, that Medicaid enrollment lasts until their 6th birthday. So we also have a complicated Medicaid system here where we contract with MCOs to deliver integrated care and care coordination. One thing I wanted to share on this slide is that we've got 5 MCOs in Washington State, and in Whatcom County, all 5 of those MCOs operate here. So clinics will often have to have individual contracts with each one of those MCOs. These Medicaid rates are, I think they're pretty recent, but they may be a little outdated from like maybe last year, but are kind of general Medicaid rates, and there might be some slight discrepancies. But one of the things I wanted to highlight was just the differences in these rates. So speech therapy we have is reimbursed. If you do a 30-minute appointment to if you do a 60-minute appointment, it's still reimbursed at the same rate of $45. If you were to get these services, let's say private pay, most of the time these would cost anywhere from $100 to $250 for those clinics to be able to not only pay their staff, but to function as a business. So within that, we have very significant provider shortages that is also inequitable. So if a family is able to bring their kid to a clinic at 10 o'clock, maybe there's an appointment, but if they have to do it after school, they might be less likely to actually get to an appointment on time. Okay, so I'm going to move into a story of success, but before I do, is there any questions about or anything that folks want to add for the Medicaid?
Couple questions for you in the chat.
Okay. Oh,
Do you want me to jump in for a second on the standard deviations, Catherine?
sorry, yeah, maybe, I don't know if I saw it yet.
Yeah, sure. I
Okay.
can ask it out loud here, so in
Yeah.
case folks aren't
What-
tracking the
what-
chat. So
yeah, what would
I
it-
asked, I asked, what would it cost to shift the eligibility threshold from 2 to 1.5 standard deviations countywide?
Mhm. And I don't know what it would cost. What I do know is that the 1.5 for ESIT and the 2 standard deviations are national, they're federal numbers and state numbers. What I do know about some of the history of IEPs and standard deviations in terms of qualifying is it was also developed to not pigeonhole kids into a disability category that would follow them the remainder of their school term. And so by having somebody have to be 2 standard deviations off means then that they're getting specially designed instruction and maybe getting pullout or less inclusion in their school day. And therefore it ends up being like a civil rights issue because we've labeled a child with a disability who may not be that disabled. And this happened with autism diagnosis and something called MMR, which is mild mental retardation, that boys were getting diagnosis of autism and white boys were, and Black boys were getting diagnosis of MMR. And it took those children out of the regular classroom and put them in special education so they weren't offered what was the, a satisfactory equivalent level of educational access. And so some of that piece, I do believe, is based on this historical perspective that we don't pigeonhole a child, that we try other interventions first. And the school districts still have room within, with a child having 1.5 standard deviations to try reading strategies, other mathematics, to try some interventions of what are called response to intervention. So there is space for the school to do that. And that's the best of my knowledge.
Right. Yeah, just to add to that, if it's helpful, we were looking at, could you expand ESIT? Like, what could that look like? And we talked to the state and they said there's nothing prohibiting a community to expand what they offer, but you would have to just call it something other than ESIT. Like if they would just have to be an alternative pathway that you could develop in partnerships, but it would have to, it couldn't be called ESIT services. And it may be sort of similar where you have a legal requirement, but then you can have alternative pathways. But it's good to think about. One story of success that I did want to highlight was around developmental evaluation. So our community just a few years ago had very few places where families could go for a local evaluation. Most families were having to go down to Seattle Children's, and we definitely didn't have any options for teenagers. And in part because of some of the work that the ARC catalyzed, was starting a local developmental clinic at Peace Health, and that has since stabilized and within our community has grown. So now we have evaluations that happen at Peace Health, Catalyst, Natural Health Clinic, and Lummi Health Clinic. And some of these places have also received Healthy Children's Fund funding to expand their services and offer additional supports. But there's certain factors that made this successful for sure. There was internal champions, there was teams that were just working with these providers to make this work, partnerships at the state level to help with training, and then also partnerships locally to help support the referral process. And it's just been a really beneficial partnership, including working with SEAS and the healthcare community. So, oh, I see a few hands in the air. Yes, Sally.
Catherine, really, I was just gonna let you know that we're at 4:45.
Okay.
And so, but we do have time for post-presentation discussion. So it feels like this should be our post-presentation discussion with you. So let's plan on everybody knowing we have 10 minutes in, both for Catherine to finish everything she wants us to say and us ask some questions.
Oh, perfect. Okay, that's really nice of you to extend that time. Well, and the last thing I just wanted to, I had a family story, but maybe we won't have time for it and I'll have to share it out later. Those are really some really great family stories. But the main piece I think was important was highlighting some of these system challenges, the fragmentation that you have, complex eligibility. Oh, I'm sorry, John, I see your hand up. I'm so sorry. I didn't see that a second ago.
Yeah, I was just curious on that previous slide talking about how folks used to have to travel for evaluations. So when that local access started up, how was that funded?
Well, Beverly can share too, but it was originally funded through HRS. Oh my gosh. What is the acronym, Beverly? It's a federal grant.
HRSA.
HRSA.
The HRSA grant, like a 5-year grant, I think.
Yes. Yes.
Okay, a federal grant. Thanks.
Yeah, sorry about that. I'm actually at the DD advisory board meeting on my other computer, which is great, which is the Developmental Disability Advisory Board meeting. The grant was initially through the American Academy of Pediatrics and HRSA on a federal level. We had $50,000 to help pay for an evaluator and care coordination and some materials here in the county. And what folks have found over time is that because we don't have values-based payment, it's really difficult to do what is probably a 3-part or a 3-visit assessment evaluation of a child to review all the hearing, speech, behavioral, everything in the medical file and history, along with doing an ADOS, which is an autism diagnostic observation schedule. And then be able to provide that diagnosis. Medicaid does not reimburse for all those visits. So most providers can't do that as their only thing. They can only do a few of those every week or every month. So it absolutely saves time of not going down to Seattle Children's or the autism clinic at the University of Washington. And the wait list right now there is about 3 years out.
I think the last offering that I'll have here is, I just wanted to present some low barrier solutions that could be considered and thought about. These are both within our existing processes, but also places to move in terms of integration of services and greater inclusion. And definitely including the families within all of the plans. But I'll pause now and would love to move into a conversation. We have all of you here who are just been doing this work for so long. So maybe while I read through the chat, I'd love to hear what folks' thoughts are, or questions, or any additions. You want me to answer? Oh, go ahead, Allison.
Well, I was just going to put a link between, you talked about C's referrals and C's. I had dropped into the chat a link to C's for folks who aren't familiar, but that is the pathway to ESIT. And I just wanted to note a connection that C's has done in terms of supporting the parents of those children who have been referred for C's. A couple of years ago, the Perinatal Mental Health Task Force asked C's to expand resource navigation. And so they now ask the parents of the children who have been referred for C's what kind of support that they need, knowing that families are often really focused at first, of course, on their child, and sometimes even a year in can realize that mom or dad or any parent could use some extra support too. And so I just, while we were in this meeting, I just got an updated C's report, and I could drop their totals in there. It's quite remarkable. And it also mentions the guide referrals that Catherine talked about.
And Pamela.
Thanks so much for sharing all this. And I definitely learned some new things, but I think there might be some value at some point in talking about the history of the C's line and all the work that parents and many of you have put in over the years, because I think the reason it's still here and it's so successful is because at its core, it was formed by community members, by parents getting together and identifying gaps and saying what they needed. And I know there's a lot of work to do, but the fact that we are where we are, that we have these resources, is just a testament to the kind of process that went into it. So I know we don't have time for that today, but the generations forward, I mean, all the like bringing in professionals to help the parents identify things. So I want to put a fine point on that.
I see Beverly nodding her head too.
Catherine, my question is, if you had, from your perspective and what you've presented today, if you had all of the Healthy Children's Fund money at your disposal, what would you spend it on in light of what you just presented to us? Like, what would be like the thing you think that might be a biggest game changer?
Oh, what a great question. I think there's a lot of things we can do with, I really do believe in relational health. I think if you focus on that as your core, you can go really far. So relational health includes things like supporting home visiting programs, supporting community health workers, supporting peers. It's the relational framework, because the systems are so complicated. Everything you hear from families is basically, you really do hear, I got lucky in order to access that. And so you need a bridge. So I think that's really, really critical. But it also, you do see the benefits of systems, things like universal screenings, things that, so it doesn't have to be a guess. Does my child qualify? How do I access it? So you also do need a framework. And I think we have some really good frameworks in our community. Things like the pyramid model or the multi-tiered systems of supports. Like, you could both support providers to be able to support kids quickly. And honestly, I would hope for less bouncing around of families, so that you're really supporting families as best you can in their communities.
We have a question in the room here.
Right. This is Sterling. I just want to shout out to Whatcom Taking Action, kind of the muscle, the brains and backbone behind all the things that we talked about today, the C's line, the guides program, Beverly, Catherine driving that from the very beginning. It's an amazing piece of work, and the envy of so many other counties of what we have for really young children who have special healthcare needs.
Yeah, it really is. I was at a meeting just on Saturday, and folks were talking about how remarkable it is that we have the C's line. And I think the other thing that's really important is there is a lot of trust within the provider community in regards to connecting to C's, and what a support it is for the whole system.
But, and how amazing, the 25 years I've been in Whatcom County, how much more knowledgeable all the primary care providers are at identifying early on when they're using screens early on and sending those kids through the C's line. It's amazing, over in 2,000 a year.
Well, if there's more, I don't know if there's more, but thank you so much for taking the time to hear this conversation and for all the work that you all do on a daily basis and just being strong advocates in all of the spheres. So if there's, I don't know if there's anything else, but thank you.
Big thanks to Catherine, everybody. And not only that, but like right on time. As the clock turns to 4:55, I will flip it to Colton and then to Tilda.
Yeah, thanks, Sally. I really appreciate it. So in this segment, we are going to hopefully find some people who are interested in writing the Healthy Children's Fund report card. So I know we have a couple new folks here, so I'll give a quick 101 on what that means. So the task force is in charge of creating 2 reports every year. There is a Healthy Children's Fund report card, which is really our opportunity to kind of look at the implementation plan, look at how the last year of Healthy Children's Fund rollout has gone, sort of compare the two, and then make recommendations where we see, where things aren't really working out, and also providing some kudos where things are really working out. So that's one report that is due in May of every year. We also have a separate report card, or not a report card, but separate report, which doesn't have a fund name. And that's all the non-Healthy Children's Fund related stuff. So basically everything we do that isn't healthy connected to the Healthy Children's Fund. That's due in September. Right now, we're looking at the one in May. Now, in order to get that due in time, last year we were a little bit late. There was some scheduling stuff. If we want to be on time this year, we need to make sure that we are getting that approved in our February board meeting. So this is the opportunity where people who are really excited about digging into the nuance here of the Healthy Children's Fund, this is your time to step up and commit to, working together with folks to build out the report. I am dropping a link in the chat here. There's 2 links. The bottom of the 2 is the May 2024 report card that Ray Deck was largely responsible for pulling together. He did a really great job of highlighting what that report should kind of look like. What's really cool about that report, and Ray, I'll give you a lot of kudos here, is if the folks who were on this committee the last time we were publishing that report, we were kind of going through some rocky times of working out a couple of the knots. It's really cool to see that a lot of the recommendations that we made in that report a year later are starting to kind of get resolved and things are moving along. So this is a really important report. There's going to be some eyes on it for sure. I'm sure the council is highly anticipating it. So is anybody interested in getting on board to get a version of this report due for our, which meeting is that? That will be our February 28th meeting. We'll probably want it done a couple weeks beforehand so people can have an opportunity to look at it before the meeting. So with that, does anyone have any questions? Do I have any immediate takers? No takers at all?
Would join a drafting team. How about that?
I'm sorry, what was that, Ray?
I would join a drafting team for that.
All right, guys, we have the expert on board, the the infallible Ray Deck. Anyone else want to join? I'll jump on too. I don't know how much time I could devote to it, but I'll be on as well. So we have 2 people. What do you think, Ray? 4 people round this out pretty well. 3? Is 3 optimal?
Anywhere between 2 and 4. Yeah. I think we can do it.
Did you know that there's a little thing that I'm supposed to follow and it says do you have time? Yes. Should you do it? No. And then the other one, so, but I'm still gonna say yes, because I can't help myself. It is kind of juicy. And the one thing I would ask, last time we presented, I think, the health department first before council. Is that still a part of this? Because I think it would be the right thing to do to let them provide some feedback.
Yeah, I think that's probably a good way to go. Get an initial draft of the report, have an opportunity to share any feedback, share it with the health department.
Which is not a commitment that we would integrate any changes. It's just an opportunity to have a conversation about it before it went to council, right? Yeah.
Yeah, it's good context. I'm going to let us stew in uncomfortable silence for a couple more minutes. We don't have public comment of 4:55, which, oh gosh, we're already 4 minutes past. Well, hold on. We did both at the same time. All right.
I just checked that.
Well, Ray, looks like we have both of us. I'll reach out to a couple of you all individually if we have no takers. But if not, we have at least 2 people on board. So.
And I note in the chat, Monica is willing to help with the next report, the September report. Great.
Oh, perfect. All right. Well, Ray, I will be in contact with you.
All right. And do we have any members of the public on? I didn't think so.
No.
No public comment? Oh, I'm adjourning too? Okay, I can do that. Thank you, everyone. Meeting adjourned.
Thanks, everyone. See ya.
I was pulling off at the last second.